First of all, I don't know how many people remember Jim Hansen, but Jim graduated from the College of Veterinary Medicine at the University of Minnesota in 1953. He went to St. Peter and practiced there for a while, came back to the University of Minnesota as Director of Continuing Education in 1967. But I like this picture, and thanks to Nicole, I have this picture of Jim with the bell, because when I think when we first had the conference, Jim and Al's vision was to have a conference that brought science-based industry education to improve the industry, and so they collaborated to create, which eventually became this conference today. But what I remember about Jim was, I think in late 80s, he was at the Brown Center, wasn't it, Bob? And Jim, at break time, you take a break, you'd all go out in the hallways and talk and chat and visit with friends and colleagues. But then Jim would get this bell out and start beating on this bell, and that meant it was time to get back into the sessions and get back to work. And so if you don't remember that, that's what Jim used to do. And so that's the part I remember mostly about Jim, is that he was really hard on that cowbell. So, all right, moving forward. The virus matrix exercise was something that was initiated. It's a collaboration actually between AASV, National Pork Board, NPPC, and USDA. And so USDA is a partner in this. I don't know that they're funding it. I think Pork Board and NPPC are funding it. But USDA is part of the working group that's helping us work through this, because we want to really understand the next time we get something like PED, how do we all interact together and maybe take a little better, manage a little better response than we did on PED. So I was kind of hard on USDA to ASV, and I apologize for that. Anyway, so we have this list of viruses, and this list was originally created by USDA staff at CIA, the Center for Epidemiology and Animal Health, and Harry Snelson brought it to the Swine Health Committee at AASV and said, we want you to go through this virus list and rank them. And so there's 43 viruses here that have been known to infect swine. And is this the pointer? Yep. Okay. And so here's all the viruses. And if you want this list, I can send it to you. Is this available, Bob? Yeah. Okay. So you'll have this list, but there's a more complete spreadsheet. And if you want that, please just contact me and get on ASV's member center or member list, member directory, and just contact me and I'll send you the entire list, the full spreadsheet. So basically, I just want to let you know there's these groupings, and we also have, so you got viruses like pseudorabies, cytomegalovirus, adenovirus, and you got other viruses that are known not to be pathogenic to swine, but actually infect swine. And so there's 43 viruses on this list. And I apologize, this is probably a little hard to see. The Spiloviridae virus here, I think when you look at the recent news with the Ebola virus, Ebola restum would fit into that family. And I would list that as in our ranking as now being a concern. We need to understand that better than we do today. So the Swine Health Committee at AASV was asked to rank these things, and we ranked them on economic impact to the domestic market, economic impact to exports, risk of introduction to reemergence in the United States, and then the zoonotic capabilities. And this is where I think the news we've had on Ebola have been, I think just the word Ebola, if Ebola and pork production were recognized together, I think it would be an issue. So we need to understand that virus better. So the Swine Health Committee came up with this ranking. And I think today, you can imagine how fluid this is, because I think today, from what we heard at this conference, this would probably be a different ranking. PED would be on this list. This is the top 8 based on the rankings that we had. So we scored them based on all those different parameters. here, and then gave them a total score, and this is how they came out. And so, and I think PED would be on that list, and I think today Ebola would be on that list. So that's just my opinion. So we decided to establish a working group. And so we put the working group together, and the goal was, number one, to recognize an emerging disease as early as possible, even if they just had clinical signs, but didn't have a diagnostic tool yet. And if you go back and look at PRRS and when it was mystery swine disease, I mean, the clinical signs were exactly the same. I mean, you had the same clinical signs in breeding herds anyway that were easy to recognize, but we didn't have a diagnostic tool at the time to really come up with what that pathogen was. And so, and I think here, Paul and I have had a discussion that some of the most important things to work up are when you get no diagnosis back from the diagnostic lab. And so I think that's important. So diagnostic detection is a big issue. So what are the diagnostic gaps when you look at this virus list? Determine virulence and viability. And I think we are still learning that on PED today. Understand effective disinfectants. And then how do we respond and who's responsible for that? So that was our goal, to put a group together to address these issues on those 43 viruses. And we prioritized them because we didn't want to take on all 43 at one time. We thought, let's take on the most important ones. And so that was where the working group started. So we want to understand the vaccine availability. If there is vaccine out there, where is it? And Dan did a nice job of walking us through the fact that there might be an effective vaccine out there for ASF today, but it's got to be serotype specific. And if it is out there someplace and it's in even a different country, where does it exist, and is it effective? If not, then what kind of research do we need to do? And this is where it's a collaboration between USDA, Pork Board, and NPPC, and AASV, is if there's not a vaccine out there, what do we need to do to do the research to develop something such as that? And there again, I think Dan did a nice job of recognizing Pork Board for initiating that African swine fever research. Understand virus transmission. That's another big part of what we need to understand in that virus list. Do we really understand how those viruses move? And then what's the possible route of introduction in the United States? And I think we still don't know how PD got into the United States. We haven't done a very good job investigating that. And so we need to understand what's the possible route of introductions in the United States on viruses that are exotic to the United States today, and then determine what are those routes and see if we can address those routes so we don't walk another one in here. So here's the working group. I got involved in this because I was chair of the Swine Health Committee at AASV, and then it's a 2-year term and you're done. So now John Waddell is chair, Harris Nelson from ASV, Joe Connors, our practitioner on the group, Dick Hesse from the Diagnostic Lab at Kansas State University, Jane Christopher Hennings from the Diagnostic Lab at South Dakota State, Michael McIntosh, who's USDA Veterinary Services in Plum Island, Kent Schwartz, Iowa State Diagnostic Lab, Dermot Hayes. I made the decision that we needed an economist on this group to determine the impact of these different viruses if one would come into the United States or reemerge, like pseudorabies. Doug McDougald. I put Doug on there because of his influence and his efforts in Canada at the time we had PED. And so Doug's on this group. Eric Bush from USDA, epidemiologist. Paul Sundberg with Pork Board. Albert from the University of Minnesota Diagnostic Lab. Liz from National Pork Producers Council. Eric Newman is an independent epidemiologist, and he's actually on an advisory role. Is Eric here today? Oh, there he is. All right. And I'm kind of still on there, just by default. So they had the meeting. We had the meeting in Chicago, and unfortunately, we had the meeting in Chicago was the day I closed on my house, so I couldn't make it. So that's why I'm last on the list. So the resource categories we needed to kind of investigate were diagnostics, epidemiology, viability of the virus, immunity, pathogenesis, traceability, biosecurity, and traceability. I think really comes back to, and I think we need to refocus our efforts on using premises IDs on diagnostic lab submissions, so we can get traceability, and that's really important. Detection and response. How do we respond, and who's responsible for doing what? And if it's going to be producers and veterinarians, then fine, but we do need help from the government, either through funding or epidemiologists that they have on staff, and then of course universities. So, and then global distribution. Where do these viruses exist, and what's the risk of those coming into the country? And so, outcomes of the meeting that was in Chicago, and there again I wasn't there, so I received this information from Harry, and I want to give Harry a big thanks. I don't think Harry's here, is he? I want to thank Harry a lot he ran the meeting instead of me because I wasn't able to be there. But international surveillance, and so we need to monitor the published literature that's out there, and we need to keep monitoring that, all the new literature that's coming out and what's existing. The comment was GenBank. China's isolating a lot of viruses, and they are submitting those to GenBank, so we now can trace some where these, even the origin paper that on the PD, the origin paper actually went back and told us it was from this region in China. So, confirm with international connections, and I would say this. One of the amazing things when I was with PIC, in the same way with any pharma company, and a lot of veterinary clinics today have international connections, a lot of them. And African swine fever, when it got into Poland, I just called the Polish vet that worked for PIC, Kazimierz, and I said, how'd this get in here? And he said, well, when there's no subsidy, when your pigs start dying in Russia, they start making meat out of them, and they start basically slaughtering them and producing pork, and they carry it into Poland and they sell it. And that's how it got in there. And you saw from Dan's slide that virus is pretty stable within the meat products. So, so we have a lot of international connections that we probably haven't exploited like we should. And I would say genetic companies, pharma companies, and even large vet clinics that travel a lot. There's a lot of support we get from international colleagues. And the support international products with collaborative funding. And that was another outcome of this meeting. And then investigate possible routes of Asian pathogens to North America. And I think that's a key point. And I don't know if it just needs to be Asia. It's probably all international, but that was the point that came out of the working group. Determine roles for dealing with emerging disease. And I think this is a big piece we need to get to understand how we're going to deal with the next one. And we can't wait a month to get an action plan together. We have to understand what we're going to do with this. And so that's what we need to do. And that's why I try to get USDA on this working group. We need to understand that. Planning should be led by producers and practitioners. And I think that's key. I think if we have next generation PCRs and sequencing, and we have pan-pathogen arrays, we need to also understand if we find something, how do we communicate that? And I don't think we understand that today yet either. So that's another issue we need to deal with. I think APHIS Veterinary Services, we need to shift their focus to a broader mission if it's necessary. And I think it was this confusion with PED that, well, it's not a foreign animal disease, so it's your issue, not ours. And so we need to resolve that. Let's face it, DHS has all the money, Department of Homeland Security. and we need more involvement from them. Right now, all they're focused on is FADs, and we need to shift their focus over to emerging diseases. And there again, agriculture research services. Their focus is not on emerging diseases, it's all on foreign animal disease. And so we need to also get more funding there. And if you remember my talk at ASD, it's pretty dismal the amount of funding that we have at ARS today. And then emerging disease diagnostic funding, it eventually all falls to producers and practitioners, because you get to a certain point where there's no diagnosis, and to continue that on, every single who's going to pay for that. So if you want to do something else, like a pan-pathogen array, it falls down to the producer and the practitioner. So we need to get that resolved as well. So this was a first phase of this project. I guess I'm telling you all the things we need to get done, but at least we're getting it done, and we're working toward that direction. Unfortunately, I don't have any real solutions for you today. So, in summary, it was decided to put a short white paper on each virus to identify gaps in our knowledge. So, which viruses do we have vaccines for? Which ones do we not? Which ones do we have diagnostics for? Which ones don't we have? Establish a surveillance plan. So that's a big one. And there again, that's quite a task. Define response roles of government and industry, and I think we need to get that resolved really quickly. That one needs to happen soon. We can't sit around and wait for somebody to make a move when we got a disease that's moving around the country. Identify diagnostic needs, and I think if we identify the diagnostic needs and we get some funding, there's no question in my mind we have the best diagnostic labs in the world, and we can get the diagnostic tests done. And explore interactions with vaccine manufacturing partners, and I think that's another one that the pharma companies can play a role in, obviously, and how do we develop vaccines for these diseases if we need those. If we can get some funding and use their expertise in how to develop these vaccines, is it possible then to go ahead and get some vaccines developed for those? So, and with that,